Opdualag contains two medications, Nivolumab and relatlimab. Relatlimab is used to treat a certain type of skin cancer, melanoma. It works by changing the action of your own immune system, directing it to attack cancer cells. Nivolumab and relatlimab belong to a class of drugs known as monoclonal antibodies. Indications. Opdualag is indicated for the first-line treatment of advanced, unresectable or metastatic melanoma in adults and adolescents 12 years of age and older. How to use. Treatment must be initiated and supervised by physicians experienced in the treatment of cancer. The recommended dose for adults and adolescents 12 years of age and older is 480 mg Nivolumab and 160 mg relatlimab. Every 4 weeks administered as an intravenous infusion over 30 minutes. This dose is established for adolescent patients weighing at least 30 kg. Opdualag is for intravenous use only. It is to be administered as an intravenous infusion over a period of 30 minutes. Opdualag must not be administered as an intravenous push or bolus injection. Contraindications. Hypersensitivity to the active substances or to any of the excipients. Precautions. Before using this medication, tell doctor or pharmacist if you are allergic to Nivolumab or relatlimab, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reaction or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist a medical history, especially of immune system problems such as Crohn's disease, ulcerative colitis, lupus, organ transplant, stem cell transplant with donor cells. Side effects. Nausea, diarrhea, loss of appetite, headache, bone muscle pain or tiredness may occur. If any of these effects last or get worse, tell doctor or pharmacist promptly. Tell doctor right away if you have any serious side effects, including signs of infection, such as fever, runny, stuffy nose, new worsening cough, mouth, throat sores, diarrhea with blood mucus, severe stomach, abdominal pain. Symptoms of liver disease such as nausea, vomiting that doesn't stop, yellowing eyes, skin, dark urine, signs of kidney problems such as changing the amount of urine, pink bloody urine, easy bruising, bleeding, swelling hands, ankles, feet, unusual weakness, fast, irregular heartbeats, muscle weakness, pain, cramps, numbness, tingling of arms, legs, loss of coordination, eye brightness, pain, sensitivity to light, vision changes. Get medical help right away if you have any very serious side effects including chest pain, shortness of breath,